Thank you for tuning in to another episode of Watson Clinic Health Talk. The thyroid produces hormones that play a crucial role in metabolism, heart rate, temperature, mental acuity, and many more of the body's most important functions. When things go wrong with the thyroid, whether it's a nodule growth, a cancer, or a hormonal imbalance disorder, the consequences can be severe when left untreated. Helping us sort through all of this is Dr. Madiha Alvi, a board-certified endocrinology specialist who treats patients from Watson Clinic, Maine at 1600 Lakeland Hills Boulevard in Lakeland. Appointments with Dr. Alvi are arranged through physician referral. For more information, call 863-680-7190 or visit watsonclinic.com/Alvi. And for more details on Watson Clinic's endocrinology department, visit watsonclinic.com/endocrinology. Dr. Alvi, thank you so much for joining us today.
Thank you for having me.
So if you could tell us a little bit about where is the thyroid, what is it, and what does it do?
So thyroid is one of the hormones producing glands that we have in our body. It is a tiny gland that sits at the base of the neck, right above the clavicles. Actually, it develops at the base of your tongue when you are super young and in your mother's womb, I call it. And then it gradually descends downwards. That's the origin and then the descent of it. It has two lobes. It's butterfly-shaped if I'm talking to a woman. It's H-shaped if I'm talking to a man. They don't want a butterfly in their neck. But there is a right lobe, there is a left lobe. It's connected in the center with a bridge called isthmus. Like all glands, whenever we're talking about glands, there are two things we consider. One, how does it look? So there are, it comes in different sizes. It comes in one side can be bigger than the other. And the second part we talk about is the function of the gland. Thyroid gland is responsible for making a metabolic hormone called T4, thyroxine. Our body has receptors. Every cell has receptors for that T4, and it gets converted to a more bioactive version called T3. That's getting into the chemistry part of it. And they together run the show. It is responsible for controlling, if you're talking about heart as the target organ, your heart rate, the contraction of the heart. If you're talking about muscles, maintaining good muscle tone. If you're talking about the gut, the transit of the gut. If you're talking about brain, all cells need metabolism, and it all starts with thyroid hormone. So when you look at the symptoms of it's not working well, which can be overactive or underactive, you would notice that the symptoms go along with, is my body running at 165 miles an hour when it is designed to run 65 miles an hour? That would be hyper. If it is running 35 miles an hour, then you will start having symptoms of hypothyroidism.
Okay.
So it's tricky, but it's all about metabolism.
Yeah, you read a lot about hyper and hypothyroidism. How common are those conditions?
They're quite common. Hypothyroidism is relatively more common than hyper, but both of them, the underlying etiology is autoimmunity. Your own body does not like you one day and decides to make an antibody to attack it.
Ooh.
Depending on what kind of antibody it decided to make, thyroid peroxidase antibody, very often we don't check it as commonly, but thyroglobulin antibody, those two antibodies are markers for hypothyroidism. Thyroid stimulating immunoglobulin, also referred to as sometimes TSH receptor antibody, is something that is a marker for hyperthyroidism. Depending on which antibody your body made, it will go and talk to your gland, bind to the receptors, and whisper, make more hormone. That's hyper. Either way, there's inflammation in the gland as a result of that, and that inflammation then gradually leads to destruction of the gland.
Ooh. So how does that manifest itself in terms of side effects and symptoms?
So there are a lot of tremors or shaking of your hands, racing of your heart, often referred to as the personal or subjective feeling of racing of heart is palpitations. If the nurse or somebody else checks your heart rate, it would be running more than 100 beats per minute. It will cause diarrhea-like symptoms when we're talking about gut. It can cause racing thoughts. Lots of young patients, women, in my experience, present with extreme anxiety and panic attacks. And before you check their thyroid, you often chalk it up to them being just anxious or having a panic attack. And irregular menstrual cycles. And one of my favorites is unintentional weight loss. I've yet to find a patient who endorsed that because you are basically burning calories faster than you would assume.
Yeah, and this is all hyper.
This is all hyper.
Okay.
Remember, you're running 165 miles
yeah.
an hour. So racing thoughts is part of that picture too. So it's equally harmful in terms of which one is better, hypo or hyper. When it comes to hormones, if they're normal, you wouldn't see me. They have to be abnormal for you to be referred to me. So that's hyper.
Yeah, either way, it's not, I would think it's not pleasant at all. And left untreated, I would imagine it could be pretty catastrophic.
You're absolutely correct. It's for both conditions, hypo and hyper. There are life-threatening emergencies associated with both if it is taken to an extreme. For hyperthyroidism, it's called thyroid storm. That's a life-threatening condition. When your heart is beating really fast and for too long and you didn't pay attention, it causes dilatation of the heart. The chambers just start to get bigger. That leads to heart failure. That leads to fluid accumulating in your lungs. People are having a hard time breathing. That inability of the heart to pump the blood effectively then leads to formation of blood clots. And you can throw that blood clot towards your brain, causing a stroke, towards your gut, causing an ischemic gut. People die from it. So thyroid storm is often, we have a criteria we use in medicine when the patient gets admitted to see where do they fall on that spectrum, because thyroid storm patient is often admitted to an intensive care unit for that. In my career, I've seen 2 patients die from it, mainly because somebody lost follow-up or somebody stopped taking their medications that were prescribed. Same is true for hypothyroidism. When you are running 35 miles an hour, not the normal 65 miles an hour, then everything slows down. Your heart rate, bradycardia, which is heart rate super low, less than 60, 35 beats per minute. Those people start gaining weight. Those people experience extreme constipation. They have severe dry skin. A lot of swelling around the ankles. And then again, the brain and the thinking process slows down. You take that to an extreme, untreated, undiagnosed, unidentified, that leads to an emergency condition called myxedema coma. Those patients can go into a coma. They lose consciousness. Everything is swollen in their body. Even if they're taking any medications, their gut won't absorb it because it's so swollen. And that's also an intensive care admission patient. We often have to sometimes put them on breathing machines, give them the thyroid hormone intravenously to revive them. But yeah, in this day and age, myxedema is rather uncommon, mainly because people seek medical attention sooner than later, so it doesn't get missed, so to say. But yeah, anytime you are making too much of this hormone or not making enough, your life can be at threat of you might not do as well.
Well, it's so great that we're reviewing these symptoms because, I mean, if anyone out there is experiencing some of these symptoms and they don't know what it is or they've been misdiagnosed and they're kind of mystified by it, this is valuable.
This is super valuable. Also, it is part of the functional health testing. Thyroid often takes the blame for a lot of symptoms. As you can imagine, the symptoms can be vague enough that the first thing that comes to a patient's mind would always be, I'm tired, I'm gaining weight, which are very common symptoms. They would often be like, it has to be my thyroid, which is where I come in. At one point, I remember a long time ago when I was in training, my Twitter handle was, it's not your thyroid.
So oftentimes you're there to rule it out.
Most of the endocrinologists would agree with me. Most of the consults sometimes we end up seeing would be, I have all the symptoms, it has to be my thyroid, but the levels are normal.
Okay.
And then there's a lot of controversy around it. The labs might be normal, but they're not normal for me. So that's where we get a lot of debate regarding endocrinologist's opinion versus functional health physicians and some people who practice alternative medicine. So there are so many opinions out there, and the patients are looking for an answer. Mm-hmm. They're looking for validation. And if somebody says, oh, I see it, it's your thyroid, let's fix it, everybody wants to feel better. So thyroid can be fibromyalgia as fibromyalgia is for rheumatology and as Lyme disease is for infectious disease.
So that brings us to screening and testing. How is it detected? Is it detected through imagery or blood testing? Or?
So for nodules, you will need an ultrasound. It is very commonly, thyroid nodules are incidentally discovered on, if somebody ordered a chest CT, looking at the lungs, the base of the neck is included, so incidental finding of thyroid nodule. Head and neck MRIs or CT scans incidentally will pick up nodules. However, for the functional assessment of the thyroid, it's blood work.
Do you get mostly referrals from primary care doctors?
To be honest, from everyone. There are primary care doctors. They do a wonderful job in terms of initial scanning. If the initial result is normal, most of the people are okay with moving on to other possibilities of explanation for their symptoms. We get a lot of referrals from gynecologists. They do a physical exam and a nodule was picked up. We get a lot of referrals from oncology, because some of their medications can interfere with the thyroid function. We get a lot of referrals from cardiology because rapid heart rate, atrial fibrillation, those patients often have an underlying thyroid problem. We get a lot of referral from psychiatrists because lots of their medications will not work as effectively as you want them to unless you fix the underlying thyroid problem. So thyroid is something that is tested no matter what, if it's a regular health exam or you present with a cardiac complaint, mental status changes, gastroenterologist will check it if you're talking about irritable bowel syndrome to see if that could be contributing to constipation or diarrhea. Thyroid is the bane of existence for all of the other so-called vital organs. So it very often, lots of consults are for fatigue. Mm-hmm. And that's where thyroid often becomes very important. And as I said, there are consults that come in, my levels are normal, they have been tested multiple times throughout the years, but I don't think they're normal for me. So most of the practitioners would actually agree with me that counseling a patient with an actual thyroid abnormality is much easier than doing a consult about it's not your thyroid.
Mm-hmm. Mm-hmm. There are normal or average ranges, I would imagine. Does that differ per age group?
The short answer is no. When you look at the reference ranges, very common example or analogy would be like testosterone for men. We have never been able to define a range for between age 20 to 30, 30 to 40, onwards. So is true for thyroid. We do have reference ranges from treatment standpoint, as in if it's a younger woman of childbearing age potential, then I would like to be a little bit more aggressive in terms of thyroid being kept in a good range. Has to do a lot with her fertility status, ovulation, weight management. Most importantly, if and when she gets pregnant, the baby does not have a thyroid for the first 12 weeks. So the baby is counting on the mother to make some extra. And human body is amazing.
It
the
really
pregnancy,
is.
oh yes.
Yeah.
The pregnancy hormone HCG goes and talks to the thyroid and says, make more hormone.
Huh.
There's a baby on board. So in first trimester of pregnancy, often the thyroid levels fluctuate appropriately, physiologically. So TSH goes low and gland starts making extra. So actually, if you are looking at those levels in reference to a woman who's in the first trimester, that's not an abnormality. That's normal. But it takes an endocrinologist to say that.
Yeah, yeah.
And then after 12 weeks, the baby's thyroid is up and running. So lots of patients who are hypothyroid and they are on thyroid hormone replacement, I often tell them I should be the second one to know that you're pregnant. And then I ask them who's the first one. And if they get that wrong, I usually tell them, please don't procreate. We're not ready.
So we haven't talked about treatment yet. Medications are an option. Generally speaking, what kinds of options are there?
That's an excellent question. That usually is the part of conversation that takes the longest in my office visit. There are a lot of options. So number one is something called generic levothyroxine. This is one of the oldest or the earliest hormone that we created synthetically in the lab. And our claim to fame is this is the most bioidentical we ever created. So we all count on it and we trust it. There are kids that are born with no thyroid, and we can give it to them. So levothyroxine, generic, that most of the insurances always prefer to cover, is the first line. This is T4, exactly what the T4 our human body makes. So assuming your body has no issues with converting T4 to T3, you will be fine. So most patients do well on just generic levothyroxine.
Okay.
Not everyone. So there are patients who would come in with extreme fluctuations in their levels. Then we have to make sure that is it the medication that is not working very well? Is the patient 100% compliant with taking the medication? This medication needs to be taken first thing in the morning on an empty stomach without mixing with any other medications, at least half hour before breakfast. The reason is it's a selfish pill. It likes to be absorbed all by itself. So if there's any food, any multivitamins like iron or calcium supplements, they will bind to the pill and decrease the absorption.
Oh, wow.
If the patient is consistent with taking it, that consistency determines how well they're going to absorb. That determines what's going to be reflected in the blood work. That determines how am I going to play with the dose.
Okay.
So that is a very important factor. Getting back to the question of formulations. If that doesn't work, then we do have some brand names that are very popular. Synthroid, for example, a company that invested a lot of time and energy into creating something that is more accurate in terms of dose, providing the exact same dose every single time you take that pill strength. Tirosint, which is gluten-free version, their claim to fame is they don't have any ingredients in it which could be causing allergies in patients. There is a Unithroid, another brand. So everyone has their own claim to fame, and very often I see patients who would say, my family member said, only take this particular brand, do not take generic. If the cost is higher when you go with the brand name, but those companies have come up with ways to make it more affordable. So depending on whichever one works best for the patient, we go with that.
And what works for one might not be the right solution for them.
Absolutely right.
So it's it can be a trial and error, kind of let's play with this and see what works best for you.
You're absolutely right.
So, but are potential treatments, are they limited to the medication realm, or is there ever a situation where any kind of surgical intervention is necessary, or you could simply give them lifestyle changes to follow?
So lifestyle changes work with everything that comes in medicine with a pill. When it comes to thyroid, there are lots of people who believe, and you would find a lot of literature out there, which basically focuses on decrease the inflammation in your body. I had that conversation with one of my patients earlier today. If you look at it, lots of people would say, I do not want to commit myself to taking a pill for the rest of my life. What else can I do to decrease this inflammation? The thing with autoimmunity is you cannot control the body's response in terms of making antibodies. But hypothetically, if you can decrease the triggers, which is stress, which is obesity, which is some other medications, I call them the offending agents. But of course, you cannot take people off of chemo or their heart medications like amiodarone. So we're limited in terms of what you can do to decrease the damage, but there are certain things that have been tried and tested and they work. For example, Hashimoto's, which is thyroiditis, autoimmune thyroiditis, which leads to slow function of the thyroid gland. Hashimoto's patients, 60% correlation of that condition with celiac disease, and that's gluten sensitivity. So what happens with gluten sensitivity patients is their body's making an antibody for the inner lining of their gut. So it destroys the inner lining, makes it very flat. So you don't absorb the goodies as good as you should, which is vitamin D, B12, iron, calcium even. So most of the symptoms, if you think about in those patients, might actually be coming from nutritional deficiencies. If you're vitamin D deficient, you're going to have pretty much the same symptoms. B12, memory issues, muscle aches and pains, neuropathy. Calcium, that's affecting your bones. And then iron is the very common deficiency that we pick up in celiac disease and Hashimoto's patients, young girls. One, we're not very focused on adequate iron intake. Second, iron deficiency is the leading cause for restless leg syndrome. I cannot find the comfortable position at night and I slap my legs around. Hair, skin, and nail quality depends on that. That's like another one of the presenting complaints for a lot of patients. So if you look at that bigger picture of autoimmunity, gluten sensitivity then leads to, if you can go gluten-free, so when you read the books that are published about treat your Hashimoto's naturally, don't need to see a doctor. I can help you, just follow this diet plan.
Right.
That is all basically stemming from go gluten-free. You decrease the gluten intake, you're going to feel better. That's technically less carb intake, in my opinion, too. You lose weight. That improves the autoimmunity as well. So, yes, thyroid autoimmunity takes a back seat, and sometimes the thyroid gland seems to calm down in terms of this self-destruction process. Selenium, it's an antioxidant. Most of the data is really coming from Europe because they tried and tested it and decreases the inflammation inside the thyroid gland. So there is a lot of data out there saying that if you take selenium, which comes in Brazil nuts, my patient told me they're expensive. I did not know that. But if you take enough selenium and decrease the inflammation that way, you can also improve, let's say, slow down the decline of the thyroid gland. But still, you're preventing the inevitable. The thyroid gland does not lose its function overnight. Unless somebody removed your gland and I'm responsible for giving you thyroid hormone replacement, it is a very gradual decline over time. So one of the things that I often read is the patients would say, my doctors can never find the right dose for me. They're always playing with my dose, going up or going down, or consistently always going up. I always tell them it's a moving target. Because each passing year, when you drop 10% of your own gland function, I'm going to go up 10% on the dose. Then some people get worried, so-and-so I know is on this dose and I'm on too much. One size does not fit all. It's a weight-based hormone. You gain weight, I go up on the dose. You lose weight, I have to back off on the dose. Lots of patients after bariatric surgery need to be taken off of this because maybe their own gland is making enough for that sized body. So there is a lot that goes into the variation of levels, and which translates directly into frequent dose adjustments.
But the factors that bring deteriorating thyroid on are essentially the same factors that bring on so many conditions. I'm sure it's recommended that proper diet, regular exercise, don't smoke, all this kind of stuff applies to thyroid disorder prevention as well.
You're absolutely correct. Genetics, if there's family history of Hashimoto's. For women, postpartum thyroiditis, which is also very common. And the way I explain that to my patients is you were carrying 50% foreign DNA in your belly for 9 months.
Yeah.
So your immunity was taking a back seat. As soon as you deliver, the immune system wakes up, and thyroid is just an easy target. So lots of inflammation happens in the gland, first 4 to 6 weeks after delivery, but everybody tells you you just had a baby. So most women, every childbirth is technically, or could be, like a slap to your thyroid. Always get your thyroid examined.
So does postpartum, does thyroid disorder play a role in postpartum, or it's possible that it could?
It could, because postpartum thyroiditis indicates that it's a self-resolving condition, which is a good thing. 6 to 8 weeks later, so by the time the patient gets in to see me, the abnormality would be in the labs wearing off.
Okay.
It's the timing and the history, basically, that matters and helps you make that diagnosis. So in those patients, if you're suspecting those symptoms at that 6 weeks postpartum check, which mostly it's the only OB appointment that they would keep. They're not going to keep primary care and everything else because there's a lot going on. Thyroid testing is indicated at that time. And if your thyroid is not working well, if somebody's dealing with severe symptoms of postpartum depression, not making enough milk, not feeling well, sleeping too much, not sleeping enough, before you say it's all because of having a new family member in the family, could actually be your thyroid. It's a very common time for it to manifest itself.
That's interesting. So you had kind of touched upon it earlier, but I wanted to ask you about this because for all kinds of conditions, you see these products marketed on Amazon or TV or elsewhere on social media. Hey, this can cure this and that. And they're usually scams. But is that the case with thyroid, hyper and hypothyroidism as well? All these cure-alls that aren't actually cure-alls?
That's correct.
Okay.
Unfortunately, when it comes to thyroid, that's a very easy target for pharmaceuticals and non-pharmaceuticals, supplements. Because everybody wants to feel good. Everybody wants to have more energy. So lots of things are advertised as, if you take this, you're going to feel good. You're going to feel better. I always tell my patients, read the ingredients. Iodine is very popular. Iodine is an ingredient for making thyroid hormone. It's part of our levothyroxine or T4 molecule. If I can give my gland more substrate to work with, more ingredient, then hopefully it can work better, and then I'll feel better. Well, keep in mind, there's a reason we use iodine as one of the treatments for thyroid cancer patients to kill thyroid cells. The key is balance. So, yes, we are not iodine deficient in America. So that's why they are not advertising iodized salt as much as cause of iodine deficiency problems or goiters anymore here. There are iodine deficiency belts around the world, but not here. So iodized salt, minimum intake of iodine for a pregnant woman, 200 to 250 micrograms of iodine intake is recommended. Anything more than that. So when you see the supplements that says iodine drops, it will give you energy. You'll turn into Tasmanian devil, bounce off the walls. Your productivity and multitasking will go through the roof. You'll get that promotion. That's not going to happen.
You're not getting the promotion. that supplement is not going to make you rich.
What does happen is, because you provided the more ingredients to your gland, it will become hyperthyroid.
Okay.
It revs up the gland. Now it starts running 165 miles an hour, and you might put yourself in danger for developing that thyroid storm. So it used to be, when I would ask my patients or explain to them causes of hyperthyroidism, I would talk about autoimmunity. I would talk about nodules being overactive. I would talk about the thyroiditis that can happen like postpartum. I would talk about recently receiving any kind of iodine contrast. If somebody had a CT scan with lots of iodine, that can do it. And now I have to consistently ask about supplements. That wasn't the practice more than a decade ago because supplements weren't this common. And you'll be pleasantly surprised how many patients would, once you ask, tell you, yes, I've been taking supplements, and I always tell them bring them with you so I can read the ingredients with you. There are lots of adrenal support, thyroid support, those kind of products that are available that promise that they're giving you. Anytime it says bovine or porcine, technically it's basically talking about animal sourced. So always help the patient make the right decision. So if my patient insists, I do not need or I do not want a medication, what can I do naturally? Then I would tell them, you can try changing your diet, go gluten-free. And some people do remarkably well. Where there's a will, there's a way. But never feel like it's your fault that you're doing something wrong, that the thyroid is declining. There are two things in life, things you can change, things you cannot change. Mm-hmm. So things you can change is definitely your diet, your lifestyle, lose weight if obesity is playing a trick in inflammation in your body. Things you cannot change are genetics. If there is a natural tendency for you to decline the production of this hormone in your gland, you cannot really reverse that. Some of my patients take it very seriously, and then they would be like, I must not have been doing something right. It's not your fault. Self-empathy is important.
But it is treatable.
It is definitely treatable. Yeah. And when it comes to saying that it's treatable, yes, talk to your physician about options. Your endocrinologist would help you pick the right one for you. There are so many podcasts about thyroid. There's so many websites. It's part of functional health assessment. It's part of holistic medicine practice. Just make sure that you get enough information from the right resources before you commit yourself to anything that might actually be futile. I have seen a lot more of those cases instead of just the regular thyroid care lately because of the amount of information that's out there, and not everyone has the ability to sort it out, reliable versus not reliable versus evidence-based or not.
Yeah. Well, Dr. Alvi, you are phenomenal.
I know. Thank you.
Thank you for coming in today.
Thank you for having me.
That's it for this episode of Watson Clinic Health Talk. For more information on Watson Clinic's endocrinology department, which encompasses 3 convenient locations, Watson Clinic Main, Watson Clinic Bartow Building A, and Watson Clinic Plant City, visit watsonclinic.com/endocrinology or call 863-680-7190.